How to understand a CBC blood test in under 3 minutes. I'm Dr. Evan Levine, board certified cardiologist. If you enjoy my videos, please like and share. And a shout out to someone who sent me this, a Snoopy to add to my collection. Remember, always consult your physician. Let's go. CBC stands for Complete Blood Count. Let's go through the list that you may see on your chart. WBC, white blood count. The cells that generally fight infection. Now, a mild elevation could be anything from an acute stress to a mild bacterial infection. Viruses typically do not elevate white blood cell count. In fact, they can even reduce it. If it is elevated, you want to know what types of white cells are increased, as they have different meanings. For example, you may have a lot of increase in neutrophils, which is more often associated with acute bacterial infection, or very high eosinophils, which can be related to an allergic reaction. Now, low counts can be related to, as I said, viral infections, bone marrow disorders, including cancers, and drugs, especially chemotherapy. Hemoglobin and hematocrit. Now, basically, they measure the amount of red cells. If you look, the hematocrit is usually around 3 times the hemoglobin. Do your math and you'll see. Now, mild reductions can be anything from loss of blood from menstruation to a slow loss from colon cancer. You may have an iron deficiency from that, or a B12 deficiency. Folic acid deficiency is almost never seen. For the most part, those blood tests are just throwing out money. Genetic disorders, as sickle cell anemia or thalassemia, can also do this. Now, older folks with falling hemoglobin, that usually means some sort of blood loss, and your doctor will check your iron levels and perform other exams. Now, remember, do not forget your screening colonoscopy. If you have anemia from a lesion in the colon, it could already be too late. It could be cancer. Also, being sick from all types of diseases can cause something called anemia of chronic disease and can result in a low hematocrit. Kidney disease can do the same. What about an elevated hematocrit? Well, that could be caused by lack of oxygen, and this includes the dumbest thing you could do, smoking, living in high altitudes. And when I see a man who's like a square peg that looks tired and has an elevated hematocrit, they have obstructive sleep apnea until proven otherwise. Rare bone marrow disorders can also cause this. Keep going down, you'll see MCV. That stands for mean corpuscular volume. It just means the average volume. Let's say size of the red cell. Normal size anemia is called normocytic anemia, usually when you have an acute blood loss like a bleeding ulcer. And big size anemia, called macrocytic anemia, is most commonly from B12 deficiency. Small size or microcytic anemia is usually iron deficiency. Platelet count. Drugs like aspirin and clopidogrel do not lower platelet counts. They reduce their ability to function, but don't lower it. So low platelet counts we call thrombocytopenia. They can be dangerous. They can make you bleed, especially when the count falls below 100,000 and below 40,000. It could become an emergency, and you could start bleeding. Now, common causes include alcoholism, bad infections, certain cancers, viral infections, even COVID, and reactions to medications. Medications can cause a lot of bad things, folks. Now, high platelet counts, called thrombocythemia, can cause excessive clotting and even make you bleed as well. And it's usually caused by an abnormality in the bone marrow. Remember, this is a very simple explanation of a CBC, and always, always consult your physician. I hope that helps.